celebrated. And I am guilty of that sometimes because I need to be on my medication and sometimes I am not compliant. I must admit, I'm not compliant all the time. And sometimes when you're not compliant, you face the consequences. And there are times when you are ill and you might get a course of medication to complete. And by the time you reach the third day and you start feeling better, what you do? You stop taking the medication. And a lot of us, we are knowledgeable as to what we're to do, but what happened? Most times we don't practice, right? And so this evening, we have a presenter that is going to present some vital information to us. And it's one of our very own right here. October is celebrated as, anybody can tell me? Only breast cancer? Only oral health? Huh? October is celebrated as Mental Health Awareness Week is celebrated in, so this week, the 10th to the 14th is Mental Health Awareness, right? And also we have Oral Health Month that is celebrated throughout the entire month of October, and also Breast Cancer Awareness Month. And for breast cancer, most people know that it's Breast Cancer Awareness Month. What happened? You see persons wearing pink. And so pink is a symbol to show that you are spreading awareness of persons with breast cancer, right? And can you, if you're a male, can you get breast cancer? Yes. What is it called? Breast cancer. So I don't want to take away from Dr. Swaby-Spencer's presentation, but from you have a breast, it means that you are susceptible, you are at risk for breast cancer. Huh? Of course you're at risk. You're not at risk, so you don't think you can get breast cancer? So don't say that because we have scriptures, the Bible did not want us to be foolish, and so that is why knowledge is important so that we can equip ourselves, all right, so that we can protect and prevent and also support others. All right, so there is a theme for breast cancer as well. Let me see if I can find the theme quickly. All right, so for 2024, this year, our theme for Breast Cancer Awareness Month is No One Should Face Breast Cancer Alone. And so this means that we're looking at the support aspect of it, right? So if somebody is going through the whole mental and the whole physical of breast cancer, then we're going to need support. And so that is why they have the theme. So I am not going to be the one to do the presentation, and I'm not taking from doctor's presentation. So we're going to invite our own Dr. Swaby-Spencer to come and present to us. And please feel free to ask your questions, and I'm sure that she will accommodate you. Let us give her a big round of applause as she comes to present.
Happy Sabbath, church. I must say that I am thrilled to see that we have a well-educated audience today. I see a lot of persons know quite a lot about breast cancer. So I'm just going to slightly take up my laptop and go back to sit. All right, so it is indeed my pleasure to be able to deliver this presentation today. It was a bit short notice, but this is my family, right? Can't disappoint. So as you all know, my name is Dr. Alicia Swaby-Spencer, and I will be chit-chatting a little about breast cancer. Now, it's the end of the evening, and most of us are tired, including myself, so I'm going to ask you to help me to make it easier for all of us, right? And by doing so, you'll be participating, asking questions, and giving me little hints where needed, right? All right. So, as we all know a lot about breast cancer, we know a lot of facts. But there are also some myths that are circulating, right? And one such myth, which Sister Roma mentioned earlier, was that persons believe that only women can get breast cancer. I am so pleased to know that everybody here today knows that that's not true. And the reason is men do have breasts. The risk of it is less in men really because their breast is smaller. They don't give birth, they don't have milk, so that is why they don't get it as often as women do. But they do have breast tissue. As small as it is, it may result in breast cancer. There are some persons who are superstitious and may say that talking about cancer can cause breast cancer. You can't tell me how that is. There are also some persons who, well, I have witnessed before, who believe that herbs, bush medicine, can cure breast cancer. I've seen people die because of this, unfortunately. There are also persons who believe that getting too many mammograms may lead to breast cancer. We care, as doctors, we care about people. We're not going to send you to do something that's going to be harmful. We take an oath, right? Thank you. Other persons do believe that getting breast cancer means that they're sentenced to death. That's not true. Some persons believe that any slight bruise or any hit on the breast can cause breast cancer. And some people even believe that touching the breast too often may lead to breast cancer. Men? Okay. All right. So before I begin, we want to familiarize ourselves with the breast, right? We all know where it is. We all know what it looks like. But what is beneath the breast? Now, this is just a small picture showing what the breast constitutes. Obviously, it has skin above, but beneath it, there's also ducts. There's also glands which produce the breast milk, and the ducts which channel the breast out. And then for some women who have very voluptuous breasts, they'll have a lot of fat tissue inside, right? Now, there are different types of breast cancers, and these types basically depend on where it originates. Now, there's ductal cancer. I will go back to the picture. You'll see that little tube there, that's called the duct. You see the little round bubbles, those are called the lobules, and the yellow area is called the fat tissues. Now, these cancers can arise in anywhere in these areas in the breast. Ductal carcinoma, which is the one that comes from within the duct, it is the most frequent or the most prevalent type, and it is highly treatable. So once you're diagnosed with this, the likelihood of surviving is great. Now, there's invasive ductal carcinoma, which is the one which is most common in our men, and it's the one that can be life-threatening. Inflammatory breast cancer, this is the one that is most aggressive. That's the one that is fast-growing, and that's the one that unfortunately leads to some person's demise. However, it is the one that we can see for ourselves once it presents, and it presents with very fulminant symptoms, which I'll describe going on. There's also metastatic breast cancer. I'm not sure how many medical professionals are here may know what metastatic means. It means that it does not come from the breast. It comes from other areas, including your lungs, your bone, and it will spread towards the breast. What causes breast cancer? I am sure a lot of persons hear a lot of stories about it, but unfortunately, we as doctors, we don't know what causes it as yet. There's no known cause, but there are some things that may result in developing it higher as opposed to in other cases. But what we do know is how breast cancer develops is as a result of damage to cells, DNA, within the breast. Now, as mentioned, there's no known cause of it, but there are risk factors. And there are some risk factors which we can control, and unfortunately, there are some which we cannot control. And we all know that we can't decide. I don't know what's happening in America, but we cannot choose whether we're male or female. In some countries, they're doing all kind of transgender thing, but we cannot choose whether we're male or female. And as we know, female are at greater risk of developing breast cancer. Or age. As we get older, our body changes, and it also poses risk of developing breast cancer, mostly because these cells are going through different changes, and when they change, that's when you can have damage to your DNA. Persons who have family history of breast cancer, they too are at increased risk of developing breast cancer. And by family history, I don't mean just your mother's side of family, but also your father's side of the family. And it is more prevalent in persons who have family history of it and it being more close-knitted. So whether it be your mother, sister, your grandmother, those who are in close generation. Persons who have personal history of breast cancer. So you may have had breast cancer in one breast, you're at an increased risk of developing it in the other breast. And even within the same breast, because as I said, breast cancer can develop within the duct or it can develop within the lobules. There is a special gene called the BRCA gene, type 1 and 2. I'm not sure if you know about Angelina Jolie. So she went and did her test after she found out that her mother and her sister and other relatives were diagnosed with breast cancer. She went and did her gene test and found out that she too has the BRCA gene. So you know what she did? She cut off both breasts. She was serious about not getting breast cancer. I mean, they have money, so they can always get prosthesis, which is the fake breast, to bring it back. But in Jamaica, that option is available as well. So as I said, persons with those genes, they're at higher risk, at about 80% risk of developing breast cancer. As it relates to your menstrual periods, well, young ladies, once you start menstruating early, meaning sometimes even 7-year-old, 8-year-old are start seeing their menses, it means therefore that you're at increased exposure to hormones, and these hormones can result in formation of breast cancer. Ladies who undergo menopause at a later age, you are also at increased exposure of hormones, and these too can result in breast cancer, or should I say increase the risk of developing breast cancer. The number of pregnancy, this is one instance in which having 12 or more kids can help you out, right? So the more kids you have, the more times you're pregnant. When during pregnancy, your hormone levels fall. Well, the type of hormone that triggers breast cancer, it changes. And during those times, so 9 months, you're without this hormonal influence, and that minimizing the risk of developing breast cancer. Persons who are on birth control, I know in our society today we use it a lot, mostly because women are very conscious about the number of children they have. But this too can pose an increased risk of developing breast cancer. You may go ahead. Hormonal. So there are some other birth controls, such as copper T, that some persons may be aware of, or even sterilization, which is cutting the fallopian tubes. Those would not be considered. Thanks for that note. Breastfeeding. So our generation don't like to breastfeed. However, breastfeeding, especially, I know some men frown at it when the women are breastfeeding their 2-year-old child, but she's actually saving herself a little, or minimizing her risk of breast cancer. So the longer you breastfeed, there is some study that suggests that that minimizes the risk of breast cancer. And breastfeeding baby. In terms of other risk factors, so as I said, there are some in which you can control and some which you cannot. These are some in which we can control. So our lifestyle habits, smoking, drinking, overeating that may result in obesity, these are some things that can contribute to increasing the risk of breast cancer. Now, unfortunately, signs of breast cancer, they are more obvious when we're at a later stage in the disease process. So you tend to see the signs when the breast cancer is there and it is heading, usually it's above grade 1 or 2 in terms of the staging. A lot of persons, once they feel like the breast is hurting them, they say, oh, we might have cancer. well, or they feel any form of lump, they may have cancer. Not true. The thing about it is that once you're feeling pain in the breast, it is usually not cancer. Pain in the breast is more hormonal. So as you may notice as women, as we go through our menses or during pregnancy, the breast becomes tender. That's because the glands are stimulated and it becomes painful. Breast cancer, however, tend not to present with pain, but more so obvious symptoms, especially in the later stage. So you may notice, well, most obvious, the lump, and you tend to feel this on examination of the breast. In the later stage, you may have retracted nipple. So normally your nipple would be protruding forward. Instead, it is inverted, and that's when the process has already started. You may notice changes in your skin texture. I'll show you later on. Lumps. So on self-examination, you may feel the lumps. In the ductal stage, you may notice nipple discharge. And by nipple discharge, I don't mean breast milk. I mean bloody discharge. I mean pus. Those are fulminant signs of breast cancer. You may see swelling of the breast, and these swelling tend to be asymmetrical. So one breast may look small and the other one may look bigger. In the inflammatory stage, which I mentioned is the bad one, let's call it the bad one for now, you may notice redness to the breast or a rash on the breast. And as I said, breast or nipple pain, you may have that, but it's usually in the late stage of it. It's not usually in the early stage. So this is one example of the rash. A lot of women notice rash underneath the breast, which is the brassiere and the sweaty. Not that type of rash. This rash is mostly associated around the nipple area. Tend to be red, flaky. When you go to your doctor for treatment, they may prescribe medication. You notice it's not helping because really and truly this one is rare. So as doctors, you come, you see the rash, you may think of a fungal infection or some dermatic change, whether it be an allergic reaction. You may start a cream. And once you notice there's no change, then doctor is going to hint at doing a mammogram or to investigate further. This is an example of a nipple retraction. So you notice the nipple area is sunken in. And what does this look like to you? Yes, it looks like an orange. This is called a powder orange appearance. So the breast starts to look, has a lot of little dimples, and that looks more like an orange. In the Ortonese orange, yes, and this is usually in the later stage. Prevention. No, this is what I am big on, because I cannot understand something that we can detect early. How is it that we have such a high mortality rate? Something that if we find and start to treat her early, how is it that we still have a high mortality rate? And this, I believe, is because people are not taking it as serious as they need to take it. Breast cancer in the later stages can be fatal. Why is it that we are not taking the necessary changes or taking the necessary actions to mitigate against it? So, weight control. Unfortunately, the more weight you have on, the more your hormone levels and the more risk you are at developing a breast cancer. With exercise, that will minimize your weight loss, and that too can encourage healthy cell habits and can minimize the risk of breast cancer. Breastfeeding, that is the easiest way to feed our baby. Why are we not practicing breastfeeding more often? Healthy diet. I mean, we live in a country era, our island is blessed. Why are we not eating from the soil more? And in terms of hormonal treatments, we really can't escape from this. As a doctor, I'm being honest, we can't really escape from it because there are instances where we have to implement hormonal treatment. But you have some female, they're not practicing protected sex, and they have intercourse today, and they feel that they may get pregnant. They go to the pharmacy, and they buy the emergency contraceptive. That is one way of putting yourself at risk, because with the high-dose contraceptive or the high-dose hormone, that is just triggering issues, right? Avoiding exposure to pollutants. Some pollutants are deemed carcinogenic. So smoking within the cigarettes, some factory places, those who live near to those areas. Right, and even the burning of some rubbish, because our dear Auntie Richie today spoke to us about BPA, right? even those that can contribute as well. So, I am big on early detection. Early detection can save your life. And early detection means you're going to practice proper breast screening, all right? So I'm just going to emphasize a little bit more about screening process for breast cancer. It's a simple test. It's something that we as women can do in the comfort of our bed, in the comfort of our bathroom, in the comfort of our living room. Just a simple breast examination every month. And by breast examination, I don't mean quickly, like I saw Miss Ann doing a while ago. I don't mean quickly touch up the breast. No, do a proper examination. So there's 3 steps to it. Well, more than 3, but I'll hint at them later on. So 3 steps to it. I hope you don't mind the picture, Sister Roma. So you're going to do these examination while standing in front of the mirror, while lying flat on your back. So when standing in front of a mirror, of course, you would remove, you're the yeah. So while standing in front of the mirror, of course, she will remove, go over so they can see. Right, so of course, she will remove her top and she will remove her bra. But with the mirror in front of her, she's going to observe her breast. And she does this every month so she can know what her breast looks like. So if there are any changes, she can note them. So she stands in front of the mirror, she puts her hands, both hands at the side, and she looks towards the mirror. You want to keep yourself straight so that you can notice if one breast is up or one is down. You want to look at the skin color of the breast. You want to look at the nipple area. You want to look if, I know some of the, yes, I know some of us breast changes over time, but you still will know if it's changing too fast. So you look at how it's aligning, both of them are on the same level. And how you do this is by looking at the nipple area, if they're lining up correctly. For the next one, you're going to raise your hands, both hands, above the head, right? Most women feel more comfortable doing that. Right? So you're looking in the mirror. It pulls your breast upward a little, and you can note if there's any nipple retraction. So you're looking at the same thing, the skin color, you're looking at the texture, you're looking at the size. Then you're going to put your hands at your side, right? And you're going to brace forward. No? Firmly, so you push it firmly. When you do that, it causes the muscles on the breast to contract, so it will show up if there are any, or you can show it. So you're going to slightly. Right, so you're doing like that now, and you observe for any changes. Also, you're going to do it while standing again. You're going to physically examine the breast. So this is just observing. You're going to physically examine the breast. So you're doing the same thing, but this time you're going to put one hand above the head, right? And then you're going to use these 3 fingers, right? And you're going to, I'm a doctor, so I can't touch you, okay? Just putting it out there. So you're going to use the 3 fingers here, and you're going to massage in a circular motion, right around. And you want to ensure that you capture everywhere in the breast. When I'm doing it, I prefer to go out and come in. So you're doing it like, what you call that, the candy wheel? Right, so you go out and you go in, so you can show them, doing it to yourself. So there are 3. Right, and around until you come around and around to your nipple. So that's very good, right? It shows that she's been doing it, right? But it's not done there, because your breast tissue actually goes up into your axilla, up into your armpit. So after doing that, you want to go ahead and examine in the axillary area as well. So you're also checking for any lump, you're also checking for any tenderness or anything. For the next step, while you're lying down, so say for example, you shower, so before going into the bathroom, you look in the mirror. When you're in the shower, you do that. When you go to lie down now, you're going to do the same thing. But this time when lying down, what we encourage is that when you lie down, you put you will put a pillow right under the shoulder in which you're going to examine. And you practice the same thing by lifting your arm rest the pillow here, it will push the ear up more so you can push anything forward. And you do the same thing with the 3 fingers in a circular motion, and make sure you take note of the nipple as well as the axilla. And you're not going to do it for one side, you do it for both sides. And you use the opposite hand. Thank you, my dear sis. All right, so that's basically summarizing how the examinations is done in terms of you doing the examination. Now, part of the screening process is the mammogram. What is a mammogram? Anybody? Miss Anne? What is a mammogram? Yes. Right, so a mammogram is a simple test, but a lot of women are afraid of it, saying that it is very painful. Back then it used to be. I don't think it's that painful anymore. So what it is an x-ray of the breast. So they basically will put your breast between two flat surfaces, and they'll do the x-ray. Now this x-ray, this is why people say it causes cancer, because as you know, most radiation does. However, this x-rays has minimal radiation, all right? And when they're doing it, they actually put you in lead, so you're covered to some extent, so the other areas are not exposed, okay? And
They can have breast cancer. How would you do the mammogram on a male if they can?
all right, so that's a very good question. So with the examination itself, but there's also ultrasound. So there's ultrasound technique that can be used, and if it suggests anything, then there's also MRI. So the MRI is only used if there's high suspicion of it. And as you know, the MRI is the one that they pass you through the person say look like a coffin, right? Same process. It's just the same technique of examining. Luckily for the men, they will see it more as opposed to a woman. The slight budge, and they will take note of it. All right, so as I said, the mammogram, it is usually encouraged for women over the age of 40. If you're 20, you're still at risk of breast cancer, especially with having a family history of breast cancer. So once you reach childbearing age or you start seeing the menses, we do encourage that the monthly breast examination as well. And in persons 40 years and over, we encourage the use of the mammogram to do the screening. And this you will do once per year. Some persons may not be able to afford it. However, the Cancer Society, they do offer discounted rates for persons who are interested in doing it. So those are things you can think about. And of course, the clinical breast examination, which is done by your doctor. So as women, we know that once per year, we should see our gynecologist, have our routine tests done, and also to have a clinical breast examination done. So this picture is basically just showing what I just did with Sister Roma. Treatment of breast cancer, it varies on the stage in which it's at. Most stages do involve surgery, and by surgery, it does not mean that the entire breast will be removed. So if it's diagnosed, if the screening is done and they do detect that you have breast cancer, and it's just a small lump and it's in stage 0 or stage 1, they may do what is called a lumpectomy, which is basically just removing the lump itself. So your breast is preserved. But most women are scared, so they rather just remove everything, right? So there's the lumpectomy, which is just removing the lump, and then there's a mastectomy, which is removing the breast in entirety. However, there are some surgeries that can be done to preserve the breast. So when they remove the breast, they can save a flap, and they can remove fat tissues from other places in the body to put it back there to give you some form of normality, right? Radiation is employed, as you know, with the radiotherapy in certain stages. And depending on the stage which is at, especially at stage 3 or 4, they may encourage the use of chemotherapy. Chemotherapy is what most persons are afraid of, and this is usually with the medication. This is the one that tends to cause the hair loss and the weight loss and the vomiting, etc. However, once you undergo the chemotherapy, you can go back to normal. Hormonal therapy is employed in cases where they do the testing for the cancer and they note that it's BRCA positive, then it can use hormonal therapy such as tamoxifen, which a lot of women tend to use nowadays, and that can minimize the recurrence rate of breast cancer. So prognosis. Prognosis means how well do you do with cancer. Most persons in stage 0, they have a 95% survival rate within 5 years, and it goes down a little to 90% in 10 years. But as you note on the chart here, the earlier it's diagnosed, the survival rate is much better. And the early diagnoses are usually picked up during the screening process, not when you feel the lump. It's usually in the screening process. Now, God takes us back to our myths that just started earlier. Based on the presentation, you realize that you can dispel all these myths because we do know now that men can get breast cancer. We do know now that the treatment of breast cancer is the surgery, the chemotherapy, and the radiation. I'm a Christian, I believe in God, but do not come to me and tell me that God is going to fix it. No, you're losing time and you're losing your trust in God because God made doctors and doctors are here to help. Do not come to me and tell me that you're going to the bush doctor and him have something mixed up and to give you. I do not argue with bush doctor because I know they serve some purpose. However, take my treatment, take the treatment, and you can use the bush medicine as an adjunct, as guided. But do not come and say you're relying on the bush medicine to treat you. I've seen women lose their lives because of this, just by saying that God is going to fix it, when we all know that God made doctors, okay? And as I said, early detection saves life. So get on board with your screening. Women over with family history of breast cancer, ensure that you do your breast self-examination and you do encourage others and your family members to have their mammograms done. That brings me to the end of my presentation. Thank you.
Question, please. My question is, I remember when we were growing up, I'm moving from puberty over to, you generally, your breasts always, or your nipple, or whatever you call it.
Gynecomastia.
Yes, and they're very hot. So, someone hearing this now, should they take it as if they're having any bout of breast cancer?
No. So this is why it's important to always dialogue with your doctor. So if it is that you note any breast swelling, sorry, you can go to your doctor. And in the young men, especially during puberty, they may develop something which is called gynecomastia. They may develop something which is called gynecomastia, which is a normal process in puberty as the hormones changes. But once they go through puberty, it is resolved. However, do not take it for granted that it is gynecomastia. Still see a doctor just to ensure that everything is okay. All right, gynecomastia sometimes may not be breast cancer, but it may be signs of other things such as liver disease or kidney failure and such. Any other question?
I listened to your presentation carefully, and I noticed you refer to you do not use the word herbalist. You refer to them as bush doctors. As yeah, you do that more than once, and that's you did not hear that. And she just said it a while ago.
Okay, so bush doctor.
She referred to it as well,
Yeah,
so
go
that's
ahead.
a derogative term.
Yeah.
Because these people existed before modern medical science. And it is documented that more people has died when treated with modern medical science than died from your so-called bush doctor's treatment. It has been documented, proven.
Okay, no problem.
All right.
So I must apologize if I say bush doctor, but it's just a way of speaking in layman terms so persons can understand what I'm saying. But I would like to know the study in which you did, the study that you did, or the study which mentioned about that.
All right, come in. Also, it is documented that X-ray and gamma radiation is a known human carcinogen. More than one medical body in the United States of America has documented that. And I don't believe as a Christian that we should go about searching for cancer. I believe that if you search for something, you will find it. And to close, I will use Exodus 15, verse 25, 26, a covenant, a promise that God gives to his people. If you follow him and obey him, none of these diseases that was placed upon the Egyptian will come upon God's people. I could say much, much more, but I'll rest my case.
Okay, so I must say that his points are biblically related. That I will not address. However, I will speak to searching for something to find it. The purpose of doing the screening is to find it if it is there. And as I mentioned in the last slide, the prognosis, the outcome of breast cancer is much better with early diagnosis. I've seen a lot of persons who have the symptoms for years and they don't present to the doctor. What they do present with, it's a breast which has necrotic tissue. I would want to say rotten tissue, but I don't want to be held by my word. But necrotic tissue that may or is very painful and look very, should I say, ugly, right? And they wait that time. When, if they had gone and do the mammogram, like I said, if you're searching, the screening is to detect it. The screening is to detect it before it reaches a later stage. I cannot come as a doctor and force you to do something. I will never do that. I will present to you what I think is the best option. If it's for you and it's within your spirituality, within your morality, you do not want to do it, I do not force you. But I know for myself and for my relative, I would say to them that go ahead and do it, because this is what studies have shown, this is what several tests have shown, and this is the outcome.
That simply means, let me see if I understand what you're saying. If I do a mammogram and you find cancer a lump, right? It's there. But if I did not have it, doing a mammogram would not next week get a lump.
I don't think.
No, because you said that you search for something until you find it. That's the point. So I said, if I don't have any cancer lump or anything, but I do a yearly mammogram.
Right.
That means not because I do it. It's the test that produces the lump.
No.
Right.
No.
So it wouldn't be the test that produces the lump. It is that the lump is there and the test found the lump. No, what I'm trying, hold on, brother. No, what I'm trying to
Like I
figure
said,
out.
I'm doing a medical presentation,
Right.
not a spiritual presentation. And right, and like I said, I cannot come and force anybody to do anything, but I can just share my medical knowledge. It is your responsibility to decide if you want to take the advice or you do not want to take the advice. But what I'm saying is that based on studies, you have plenty of women who've been doing mammogram for years.
That's what that's my next question. If you have 20 women, for argument's sake, doing mammograms for 20 years, how much of those persons would necessarily, because if the case is that the test produces the cancer, then after 20 years you would have 20 cancer patients.
Right.
So I don't think a test really produces cancer.
Right, it does not. It does not, because you have.
When the mammogram detects cancer
not saying that. But we're also saying that we're living in a society where there are so many risk factors. As Auntie Richie presented this morning, even the containers that we're using are exposing us to cancer. So we are living in a world where we have high exposure of carcinogenic materials. And so if this is high, it therefore means that the risk of cancer is high. So it therefore means that the mortality will be more. You were saying something?
Let me just say, all right. There's a state, Elder Cockett said that, it's not Bush. But you addressed that. You did say that if we come to you and you give us our medication, then you can use the Bush doctor. Herbalist. Okay.
Herbalist.
Okay. We understand what you're saying. But I agree with you. Elder Cockett, you have to look at it this way. The discussion is not about. All right, let me put it from this direction. If we as Seventh-day Adventists was following that text that he mentioned, there will be no need for Dr. Spencer to be here today. You understand? Because we would have, and that is true what he says, If we follow what God says, then we have no need for this. The people of God would not have any need for this.
If Adam followed what Jesus said, then there would not be sin.
Listen carefully. There is a cause and effect situation here. Yes? If we live, and the promise is given in the Bible that if we live according to the guidance of God, then these things will not come upon us. Isn't that what he said? Isn't that what he said, Elder Cockett? Yes. And that is true. So I don't know why we're saying it's not true. So this afternoon, we are here discussing cancer awareness, and we are looking at how we deal with cancer. Yes? And that there's an agreement that, yes, the herbalists, there is some positive in that. We don't disagree with that. Or naturopath, that's what you want to call it. There's not
naturopathic medicine, and we do support it. We do.
And yes. And so it is a situation that we're looking at, that the reality of life is that people have cancer. Yes? And that the choice is yours. Yes. Whether we want to use the naturopathic, there's nothing wrong. And whether we want to go the direction of, that's your choice. Yes.
It's your choice.
But we also support also the naturopath situation. Yes. Of course we support that. That's 100%. We support that. And so I just want to ask also, along with, just to make that statement and to say, the lump, if the lump is cut, right? My question is, if we cut something, right, and you have to have treatment for it, but what about what is causing it? Suppose, for instance, I'm working at a petrol station. Yeah? I don't know, a petrol station. And the leaded petrol and all these things that I'm inhaling may be causing it. We have to look at, don't we have to look at removing these from our environment? No, when I say removing, I don't mean remove all gas stations, I'm back personally, I'm working there, so I have to, I have to look at that. What is causing what may be, and we don't know. So I want to ask, do we go through a questionnaire situation where do you work, what is your diet like, what is so and so. So we can narrow it down to something that may be a root cause. You do that like a screening like that?
So as in the first slide on the presentation, as I said, there is no known cause of it. So there is no known cause of it, but what we have identified are risk factors to it, right? And these are some of the risk factors. We're not saying these risk factors cause it, but we're saying that over the years, studies have done, we showed that these are the persons who we know have cancer and the stage of cancer and the type of cancer. So as I said, there's no known cause per se, but how it comes about, which is what is called etiology, or the pathogenesis, is that there's cell change or there's the DNA change that cause the cancer. And we believe that these risk factors are some of the things that may have encouraged it.
right? Right. I was saying that as Adventists, sometimes we have to be mindful of some of the things that we say and how we say them. Because with the greatest of respect, Elder Cockett, of more than 20 slides that were presented, you had a question to ask, or perhaps an attack to launch. Now, as far as I'm concerned, again with the greatest of respect, herbs are not buildings, and herbs are not animals. They are bush. 6 of one, half a dozen of the other. Ella Price, you take it from here because you look a bit more peaceful than I am. Well, it's not about, we all know what this
All right, so this is my time. This is my thing. Let me preface by saying this. And I'm talking to Ella Cockett, I'm talking to the church.
I'm a member of this church because if it was an invited guest speaker,
I'm talking to the church generally. No, this is it. They are herbalists, Brother Ella Cockett, and they are bush doctors. I know bush doctors, and I know people who have studied herbs over the years. I know people who have come up and treating people and have no idea what they are doing. So they are bush doctors and they are herbalists. So you have to understand that when people make statements generally, even though it might seem like everybody, people say all the time that Jamaica is a bad place. Yeah. But I know I'm not a bad Jamaican, and I am proud to be Jamaican. So I'm saying, let's work within the context of what we know. That's one. Two, my God is amazing. And my God can do anything. But the fact of the matter is, yes, Genesis, the text says, if my people are called by men, if they obey, I will not cause. But he calls people out of the world. He calls people who have been living that type of lifestyle where they are now in a new environment and they come into this new environment with the problems that they're having. So it cannot be that presentations like these are necessary. And this is very important for a church. Also, not just because of who is inside the church, but I have a sister. I have a mother who is not a practicing who is not a Seventh-day Adventist. I have people who grew up in the Seventh-day Adventist church that are not practicing Seventh-day Adventist lifestyle. And I try to talk to them. But I need information to know that, listen, if something happens, this is how we proceed. But because when we get information, we do not only, hold on, let me finish, brothers and sisters. When we get information, oftentimes, and that is a problem that I think we have even as Christians. When we hear a message up on the pulpit, the message is not only for you. Take it and digest yours, but make sure so you go share it with somebody else and tell somebody what you have learned and grow. Because this presentation is not just about me. When I am listening, I am thinking about my wife. I am thinking about my mother, my sisters, my aunts. I am thinking about all the other women that is not practicing the Seventh-day Adventist faith that I believe in. So I am saying we have to ensure that when we garner information, that we not just take it out of context, but we ensure that we process what is being said. Please.
Finish. Okay. So, thank you very much for your presentation. I too have concerns re mammography, and I have to go and read and study, but also I have to weigh my own risk as we do with anything. Now, as Adventists, we've been given a health message, and if a lot of us were practicing the health message, we wouldn't get cancer in the first place. And imagine now, there are other factors. I'm just saying, some of us are plainly not doing as much as we've been given. Even the Ministry of Health, they're giving you this. Adventists, we get nothing, but the Ministry of Health say, eat more fruits and vegetables, cut down on your meats, and exercise at least 30 minutes a day. How many of us are doing just that, the bare minimum? So now when we get into a situation where we are in trouble, and I believe God created doctors and medicine to help us, where we are in trouble, how many of us have the discipline where we were not eating, we were not used to a certain diet, all of a sudden, some people do it, and God bless their efforts. They take out the lumps and then they treat their bodies well with the fruits and vegetables and stuff that they've been given. But how many of us have the discipline where we're going to cut out all sugars, where we're going to reduce inflammation, where we're going to do what is rigorously necessary to get rid of this disease that is going to progress if you don't change now, and especially depending on what stage you catch it to. Everybody has their own decision to make, and everybody's lifestyle and resources are different.
Just to conclude,
just to say this, as a Seventh-day Adventist, I truly believe in the Seventh-day Adventist lifestyle, the diet. But we have numerous Seventh-day Adventists who practice diligently the Seventh-day Adventist lifestyle. I'm not talking about even eating processed food. People who has never eat any of that and they practice and yet they get cancer. And the thing is this, it ends up that people are dying and wouldn't even say they are dying because they are embarrassed because of what they preach about the diet. And the text that Brother Peter quote, I always find that text interesting. None of these diseases that is come upon the Egyptian will come upon you. And when I look at the Bible, and I know it's not a biblical discussion, but Elisha, I know I'm just going to say something, one thing. Elisha was so filled with the Holy Spirit. Elisha was so filled with the Holy Spirit that when Elijah's bone was in the grave, they threw a dead man in the grave, and the dead man touched Elisha's bones and he got up. Elisha was sick. The kings tell you that Elisha caught a disease, that he was sick for a very long time, and that's the disease that killed him. So we will now have to balance out. So what? Elijah wasn't obeying God. We have to understand that we live in a sinful world, brethren, and we can practice as much as we want. You go out there and they spray some chemical. You see the bush people walking around and pick. The men who spray the ground, they spray chemical, the jack in the bush and everything that you pick, the chemical reach and it just the same. We live in a sinful world.
Yes, I want to say, indeed, I believe in the Bible, indeed, that what God says, taking God at his word. But I believe at the same time that because God's people have not been following God's directive, God is a loving God and a merciful God. So he brought about the doctors and the various individuals in the health system to take care of these individuals. It's just like in our world today where we have, just the other day we have COVID. And some people have known much. And I said, some people have been in the lab as chemists and they from church. And they know what are the components of the vaccine and everything. And I'm just bear with me as I'm addressing myself. No, listen to me. No, I'm just saying something. I'm saying God in mercy. Because something have occurred that would have taken so many lives. God in mercy create an interventory situation that helps to save the lives of people. Take for instance, if there were, people in our world today you are met in an accident and you have lost some blood. And probably way back there they didn't know about you have another person, you have the next person blood type or the person have your blood type. But nowadays we understand that you can go and give blood. That is life-saving. Whereby we have seen where knowledge have increased. And so people are helped. Even Sister White, if you read the Spirit of Prophecy, Sister White speaks about the doctors and the nurses and the various persons in the health system who help. And where there are negative situations, you will see that she speak and give advice as pertaining to certain things. So I believe that God, I'm not bashing, Elder, I'm not bashing. I'm just saying that what had happened is that God have used, because God's people are not going the way they should, that God have used an intervention.
Yes, long and short of it, we're doing a breast cancer presentation this evening. And even though I know some of the stuff I know, I have learned a lot this afternoon. And I think that we should be more aware of what is happening to our bodies. And we are to go ahead and do the checks as we were told, just to prevent, because today you cannot have it and tomorrow you can check and you find a lump or you find something in it. So I think it is on us now that we know to try to prevent certain things from happening and to tell others, to share with others what we have learned this afternoon so that they too can prevent certain things from happening to them. Thank you.
Okay, thank you, Miss Anne. So,
one of your breasts is bigger than one. It's true?
not just your breast, but other sides of your body. So that's why we say get used to your body. Know what it looks like normally so you can note if there are any changes. Just to conclude. Okay.
Oh, just the health message. And many times, this week, this gentleman, he came and he did some work at house. And he said, yesterday was his birthday. And he's 81. Pushing wheelbarrow, carry one ladder, come. And this man, him just have to write rum on the paper and him drunk. And this man, I can't believe that this man is 81. And when I look at Pastor Mahabi shouldn't dead now. He shouldn't dead yet. He shouldn't dead. Because that man practiced the health message.
Brother Cornwall, there are so many other factors that contribute to our
And he
health
died
condition.
from cancer.
So it's not just your diet, it's not just it's so many things. And like I reiterate, these things are not what causes the disease. They increase the risk factors. Understand that we have to be very mindful of the source in which we get our information from. Or there, Mr. Cockett here was saying about the medical issues. Our dear brother here wears a pair of glasses, which was prescribed by a doctor. I'm sure he adheres to Exodus, right? However, he's still wearing a pair of glasses. That's because his eyes is deteriorating. And even if it wasn't prescribed by a doctor, it was made by a professional in the health field. So, going forward, there are things in medicine, there are things in life in general that we have a choice what we want to do. There's information here to guide us. The Bible is here to guide us. It is the way forward. Not everybody listens to it. As doctors here, this is the way forward. Not everybody will listen to us. But for those who will listen and those who will hear, take the necessary steps that you need to adhere to. Mammogram, you may be skeptical of it, and you may want to do your regular breast self-examination. That's fine. There's also other risk factors such as obesity, such as smoking. You minimize those, you eat healthy, you exercise, you take the necessary step. If it's not for you, then I will not force you to do it, but I can advise you. When patients come into my office on a daily basis, I prescribe the medication, I encourage them, but I cannot take it and push it down their throats. Okay? So going forward, information is here. I was invited here to make a presentation just to educate or just to help to reiterate certain facts. So I'm just passing on the message. So remember, ladies, and remember to tell your relatives and your sisters and your even your brothers to ensure you continue with your healthy lifestyle, practice your screening practices, and just to take note and to make necessary steps where possible.
Those men who are most susceptible to breast cancers are those men that you see like them big breasts like women.
If they're more
Yes, I see some men with some big breasts like women.
and they can't avoid it, but remember obesity.
But some people are flat like Brother Cockett.
Still get
No, I don't think they can have any.
Okay.
You choose who you argue with, or you choose your debate.
Choose your battles. Okay, as Brother Price would usually end his sermon, and I'm going to end this presentation. If there be any virtue, if there be any praise, think on these things. Dr. Swaby-Spencer, we thank you so very much for coming and informing us. We are very happy that we were able to have somebody amongst us here to impart such wonderful knowledge on us. And I'm seeing persons online, they too are enjoying the presentation and they too are commenting. And I know that they too were blessed with the information that you give us. And ladies and gentlemen, please let us not be foolish. Let us be wise. She came and she told us how to prevent. Breast cancer is very prevalent. And doctor didn't tell you that in the Caribbean, Jamaica is leading where cancer is concerned. We in Manchester and St. Elizabeth, we are leading in the entire Caribbean. And so, let us not be foolish, but let us take heed. There is no harm in checking your breast on a monthly basis, men and women. Nothing is wrong in checking your breast. We all have breasts, men and women have breasts, right? And so I ask my congregation to just give her a round of applause. Thank you, Doc. And we look forward to you coming again and doing more presentations. All right. At this time, I'll invite Elder Price to come and do Vespers. Okay, ladies and gentlemen, brothers and sisters, I am kindly asking, well, let me not say kindly asking, but just to let you know that the last Sabbath of this month, we're asking persons as best as possible to wear something pink. So the last Sabbath of October is Pink Sabbath. So we wear something pink, all right? Yes. So it's Pink Sabbath. Yes, Elder Cockett. So you will come in something pink. Right. So we're going to stand in solidarity, and it is also month of October as Breast Cancer Awareness Month. So we wear something pink. And as I say, the theme for Breast Cancer Month is what? Lending support. So now that we have the information, we are going to support others. Encourage them, Brother Cockett, when you go out there and giving the message, ask them when last then do them breast examination. Okay. Elder Price.
All right, brothers and sisters, let's